Hi everyone, welcome back to the fifth and final week of the educational topics that we're covering as part of our OA classes. If you haven't already, obviously please click back and watch the previous four videos. But this week we're going to discuss pain management. Okay, so we've obviously discussed ways to manage your pain and best link them in with some of the other topics such as nutrition, sleep, and exercise. This week we're going to just delve into a little bit more detail surrounding pain and basically just trying to expand your knowledge on your pain to help improve your outlook on it. And we're going to get into why that kind of outlook of your pain is crucial to help improve your pain. So going on to the first slide, on the screen now is the official definition of pain. Okay, it's an unpleasant sensory and emotional experience associated with or resembling that associates with actual potential tissue damage. So that's quite a lot of words. And when I first read that, I knew I had a headache anyways. So let's kind of break it down a little bit more. So we'll start with the first line, an unpleasant sensory and emotional experience. Okay, so obviously we know that pain is an unpleasant feeling. We don't want to ever experience pain. But it is important to know that the sensory side of things refer to more the mechanical side, so what you actually feel, and the emotional side kind of refers to how you feel towards that pain. Okay, so that if you have an unpleasant emotional outlook towards the pain, it can actually increase your pain. And obviously, that's just not just regarding the pain, it can also be more of anything else going on in your life at that time that can help, or not help, but really increase your symptoms as well. So it's always worth noting that, things like stress, a lack of sleep, or some, stressful period in your life can all affect your pain. And then the next section is basically going over that pain can be present with or without tissue damage. Okay, so that's just or resembling that associates with actual or potential tissue damage. Okay, pain can be present with or without tissue damage, but that doesn't mean your pain isn't actually real. Okay, as linked above to that emotional experience as well. Pain can be completely emotional response and something's going on. And I think that last stat there as well kind of summarizes or helps reassure us a little bit more. Around 1% of all musculoskeletal presentations in primary care will be due to serious pathology. Okay, that's really reassuring, hopefully for you as well, that only 1% of the pain that we see may only actually be a serious pathology. And what pathology basically means is just a fancy word for a condition, so like a torn ligament, a muscle, or a tendon. Okay, and only 1% lead to anything serious, which is really positive. Of course, there are those less serious ones, but we do expect you to recover from those ones. So moving on to the next slide. So here is kind of a cycle that we'd see within clinic with some of our patients. So we look at the top here, okay, and I'm sure as I go through this, some of you may actually link yourself to this kind of cycle. So the patient has an illness or an injury causing fear or concern, and then the family offers support. Okay, so that in itself, of course, is completely human nature. Okay, pain or injury or illness is going to cause you to feel scared, maybe concerned about your health, and then the family around you would offer you some support. Okay, so the patient rests because of worsening symptoms, and hope and trust also worsens. Family helps with daily tasks. Okay, so here is where we start to kind of fall into the trap of reducing our activity. Okay, so as soon as we start to reduce our activity, our function will start to reduce very quickly. Patient then seeks medical attention and feels loss of control. We know pain can be debilitating and can almost take control of your life, and your whole life could be focused just around you trying to manage your pain. So this is where this kind of start to take place. Okay, and then going down to that one towards the bottom there, patient increases activity, has flare-up of pain and fatigue, feels anger and frustration. So these first three, okay, we've already started to reduce our activity in these stages, and that's normal. That is a normal thing to kind of do. Okay, our body obviously doesn't want to move whilst in pain. Okay, but it's really important that when we start to come back and trying to increase our function, it's not uncommon to kind of have those increasing symptoms, and that can be really frustrating because at that point, you know, you're trying to make a change, you're trying to reverse what you've kind of done, and you want to gain control of your life back again. But with that, because we've already deloaded the body, and unfortunately our body loses all of its function a lot quicker than we can regain it. Okay, so it's always worthwhile just noting that you're better maintaining than losing and then trying to regain. But that can then increase your symptoms once you try and force that regain to take place. Okay, but it's also worth noting as well, those flare-up symptoms aren't always bad. Okay, those flare-up symptoms are something that we may have to push through a little bit just to see that improvement. And then to go on to the next, so we're now flipped to the other side of this kind of cycle. Patient becomes deconditioned, which is what I've just discussed, has decreased functional capacity, feels guilty and withdrawn, and then the family starts to do everything. Okay, and that's kind of the trap as well. Once the family starts to do everything, or your friends start to help you do kind of most of your daily living tasks, then obviously that deconditions you even more at that stage. Okay, patient self-limits activity because of obviously the pain and his previous experience with trying to increase activity and the flare-up. Anxiety, sadness, and irritability and low self-esteem starts to kick in. And of course, this is the kind of negative experiences or emotional experiences that we're trying to avoid to help limit our pain. And then the last bit there, up towards the top left, patient experience social, financial, spiritual, and occupational changes, feels depressed, and anxiety kicks in. And then families discourage and withdraws. So obviously we want to avoid all this taking place, as with each kind of step it might seem harmless, but it does lead to, you know, an increase of symptoms, an increase of the negative outlook on the pain, a decrease in function, which is really hard to fight, to try and get back, because obviously we then have to push into a little bit of pain to try and fight that back. Okay, and that's what kind of we're trying to do here is the role of us and a team at Vita Health Group is to hopefully try and prevent you from going too far into this cycle and try and maintain your function as you're dealing with your pain. Okay, and then this here is just kind of a time frame of what we would consider, which is like long-term pain, that middle bracket of pain, and then short-term pain. So 0 to 6 weeks is more acute pain. Okay, so that's a pain that you might recover from pretty quickly. It could just be due to like an acute injury, maybe you've had a fall, maybe there's some tissue bruising, and that subsides within around 6 weeks. The subacute pain, okay, is defined by 3 to 6 months. Okay, now that might seem quite a long time, but in the grand scheme of things, you know, across your lifetime, 3 to 6 months isn't anything. And then chronic pain is considered once it gets beyond that 6-month period. And it is worth noting that it's not always, you know, your pain doesn't just get worse and worse and worse and worse and worse as you go from acute, subacute to chronic pain. Okay, sometimes it can actually get better. Obviously, if it's an acute accident, your pain may last for 6 months, but it should get better with each kind of step along the way. Or obviously it could get worse, but it's very unlikely to get worse beyond that chronic pain kind of period there. But we just thought we'd put that in to kind of summarize, and this is kind of some of the terms that we may use with patients in clinic, and it's really good for you to have that kind of understanding around acute, subacute, and then chronic pain as well. And then this one here, so this is obviously a really important slide. How do we manage your pain? Okay, so we're going to go through each of these kind of steps, and you'll probably notice that some of these will link in with each other towards the end as well. So if we look at activity modification, so what does that mean? In the acute phases of your injury, or of your OA even as well, we might want to reduce your activity level. Okay, this is because we also want to let your symptoms reduce a little bit before we start to increase. Okay, and that's really important, that bit there. So we want to reduce to increase, not reduce and then just level it out there. We want to reduce, take a step back, it takes take 2 steps forward. Okay, but on the flip side as well, maybe in your condition such as arthritis, we might want to increase your activity modification straight away to help increase that function, because the longer we leave it, the harder it becomes to kind of regain that overall function as well. Talking therapies, This might not seem appealing to some of you, but talking therapies have been shown to be really effective to help manage pain. So even just, and it doesn't need to be with a therapist, I should say that as well, it can just be having that emotional support around you. And that kind of links in there to that 1 second from the bottom is a social group. Okay, so social group and talking therapies link in together quite nicely. And that's where you just kind of discuss your pain. You surround yourself with people who are in a similar condition than you. And it gives you that emotional support as well. And this is also something that you can experience within our group classes. You're in those group classes because there's a few of you will have a similar condition, if not maybe something unrelated, but you're all experiencing pain, and just being in that environment can help you kind of give yourself that support to push forward. Light exercise, okay? Again, that links in with that first point. So with light exercise, we get a bit of endorphin release. We start to move the joints through the range. We can build up the muscle. We can maybe lose a little bit of weight there, and all that can help decrease our pain and symptoms. Education, which is of course what we're doing now. Having a more understanding outlook on your pain, and understanding that there isn't always tissue damage present with pain, can really help reassure you and help limit any of that anxiety or stress surrounding pain. Nutrition, as we discussed last week, of course I think it was last week actually, maybe it was week 3. Nutrition, certain foods can increase your symptoms, such as those processed sugars, or maybe having a high fat diet can increase your symptoms as well. So taking again control of that nutritional aspect, making sure what you're putting in your body is going to benefit you and your symptoms, and then help you with your pain journey. Sleep, of course, sleep and relaxation, we'll cover these as one, sure. Sleep is really important to help reduce obviously those stress hormones, and it can also help regulate some of those other hormones such as ghrelin, which is your hunger hormone that we covered last week, and then your estrogen, which is your hormone which can be there to help with bone and joint health. Of course, to be able to sleep, we've got to be relaxed. So things like meditation can really help. Those breathing exercises can help reduce that muscle tension that some of you now refer to. Muscle tension is really important. Muscle tension can be a protective mechanism by the body, or muscle tension can be actually us subconsciously, because we're in pain, kind of tensing up and trying to limit that movement through the joint, and that becomes all very tense. Physiotherapy, of course, this is what we're doing now. Physiotherapy obviously kind of involves with the light exercise. It involves advice on nutrition, the education, and the sleep, which is obviously all things that we've covered now as well. Social groups we've covered there. Obviously being in a group that you're social in, you enjoy the company that you're in, can all help reduce the anxiety around pain and decrease your symptoms. And then pharmacological support. So what we're referring to there is obviously the medication side of things. I will say one thing: if you're going to take any medication, I would always consult with your GP first, because I know some of you may be on different medications, so it's worth knowing about the different side effects of each, because you don't want to be giving yourself certain medication and it's going to counteract anything that you're currently taking. But what I will say is, what's been proven to be really good is, and this is quite handy for people who maybe don't want to take tablets, is like those topical anti-inflammatory gels. So you'll actually your Voltarol, your ibuprofen gels that you actually just squirt on your hand and then rub it over the joint, wherever it's your knee, your hip, your ankle, your hands. Those can really help reduce your pain, and that also doesn't mean you get any of those nasty side effects that may come along with taking some of the stronger medication. Of course, if you are going to start taking some of the stronger medication, please consult with your GP first, and just make sure it's not going to counteract with anything that you're also currently taking. Perfect. So that obviously concludes all of our educational content videos. This was quite a big week in terms of the pain management side of things. If you do have any questions, please bring them to the next class, and we'll try answer them best we can. It is worth noting, pain is a very complicated topic, so there's a lot of different branches and how to manage it, and a lot of stuff that we might not have covered in this video. But try not to get too worked up about it all, and just focus on what you can control going forward, and then just do that. Okay, so in the meantime, please look after yourself, have a lovely week, and I'll see you all soon.